Good morning. Introducing my name is Lisa. Okay, I will share the meeting this morning to discuss the development of the coronavirus in the world. The coronavirus is not an ordinary virus. This virus is increasingly having new variants that are increasingly rampant and make panic and fear many people. Surprisingly, this increase in the number of sick residents has decreased slightly in the past few months. However, after the wedding of the governor, Mrs. Kofifa visiting residents affected by this virus has increased. Thank you.
Well, first, I say good morning to all. Here, I'm Lisa Romla Apriliani will discuss this morning's meeting regarding the development of the COVID-19 case in Indonesia. Here, I will also present the gravity of the development of COVID-19 from the beginning of June 2020 to the present. Well, as we know, the arrival of the coronavirus, or commonly known as COVID-19, was at the beginning of March in 2020. At that time, it was reported that there were 14 national (WNA) who were exposed to this coronavirus. Namely, at that time, it was known that a person was a Japanese citizen, whereafter he visited from Indonesia, and then when he arrived in Malaysia, he was immediately reported dead, where the citizen, after paying shares for information that at that time he visited Indonesia, met mothers aged 6, 4 years, and 1 other people. Since then, there have been rumors about the coronavirus, which is nothing but what is commonly referred to as COVID-19. The issue continues to circulate over time. The government continues to monitor the development of the virus in order to protect its people so that not many people are affected. There is government handling by creating a task force to accelerate the handling of COVID-19. The decisions was made based on the presidential decree no. 7 of 2020 in tribunnews.com. Until now, it has been counted 1 year of COVID-19 that has hit the country and has not yet disappeared. This disease outbreak in increasingly changing the months, saying this development shows that Indonesia has a lower percentage of active cases than the world and a higher percentage of cures. The height of the world for this ration quality of treatment is the key to reducing active cases and deaths, as well as improving recovery. Finally, For this reason, quality of treatment is the key to reducing active cases and deaths, as well as improving recovery. Finally, the government and the health minister appeal that all regional heads from villages and sub-districts, regencies, or cities to the province to reflect on this group and continue to improve coordination and collaboration of all levels of society in order to achieve the best possible quality of handling COVID-19 to suppress transmission of the virus. That's all the discussion meeting I just want to say this morning. I would like to express my gratitude. Thank you.
It has the highest COVID-19 mortality rate in Asia, hovering at around 8 to 9%. Indonesia also has the most number of coronavirus deaths in the region, second only to China.
To be honest, the government's early response of their tackling of the COVID-19 pandemic has been substandard from the very beginning. If you recall earlier in the year when China, when South Korea, Singapore, countries around the region started declaring their coronavirus counts, Indonesia was still very much in denial about how many cases they had. They even declared that they didn't have any COVID-19 cases well until early March.
Indonesia has been ramping up its fight against COVID-19. But there's concern that the move may have come too little, too late.
The phone is ringing and tells our mother passed away. It's completely blown my mind, drowning in the sadness.
They were only given 4 to 5 hours to prepare all the funeral arrangements, and only his wife and a priest from the church were allowed to be at the funeral.
Can you imagine the one you love? No one can come, only my wife and one priest from our church.
Indonesia's health ministry has admitted that the mortality rate of 9% is much higher than the global average. But the true number of COVID-19 related deaths may never be known.
The majority of observers know that the figures that are being released by the government is perhaps far from accurate. If we look at the numbers of admissions to hospitals alone, if we look at the numbers, the higher levels of mortality rates across cities, across Indonesia alone, we know that this number is not correct. So the danger of using this kind of figures as a measure to how well Indonesia doing is dangerous because it's just simply misleading.
Does Indonesia, a country known for its inadequate medical infrastructure, have the resources to handle the rising number of patients?
Indonesia has one of the lowest testing rates in the world. So far, the country has only tested around 108,000 people, which means it has tested only around 319 people per 1 million population, which is much lower than Vietnam, for example, who has tested more than 2,600 people per 1 million population.
Indonesia faces a severe shortage of vital breathing devices to treat people with the disease. According to the Health Ministry, Indonesia has just over 8,000 ventilators nationwide for a population of 270 million people. It also has 2.7 critical care beds for every 100,000 patients.
And then we look at the number of hospital and number of physicians or doctors, they all far below the demand.
According to a 2017 WHO survey, the country only has 4 doctors for every 10,000 people, well behind Malaysia, which has 15 in terms of doctor-to-patient ratio. There's been an extremely high mortality rate among healthcare workers. As of early May, the pandemic has killed 38 doctors and 17 nurses.
This is due to lack of facility, like PPE, for example. Indonesia's healthcare at the moment is on the brink of breaking down because there's just so many patients.
Pernah disampaikan bahwa ini kita masih di fase awal gitu. Yang mana begitu nanti pertumbuhan tinggi, tenaga medis sudah nggak mencukupi lagi. Baik dari sisi fasilitas rumah sakit, kamar, maupun tenaga medis sendiri. Karena tenaga medis terbatas.
President Jokowi has reallocated some $26 billion from the 2020 budget to fund the fight against COVID-19. The government has also recently built a specialist hospital on Galang Island in Riau to treat COVID-19 patients from across the nation. A team of Indonesian engineers are also working around the clock to produce compact ventilators.
Of course, these have to be supported by follow-up policies so that these steps could be effective.
But in a dramatic turn of events, the government has signaled that it will ease some of the social restrictions to curb the spread of the virus. This is despite criticisms from epidemiologists who warned against easing such restrictions too early unless it has strong evidence to show that the coronavirus curve has been flattened. Amid the economic downturn caused by the COVID-19 outbreak, according to government estimates, some 5.2 million people will lose their jobs, and almost 4 million Indonesians will fall into poverty.
Indonesia is facing a tough choice at the moment, right? Whether to safeguard its economy or save the lives of its citizens. And a lot of governments around the world are facing the very same choice right now. When to open up restrictions, what to do next, etc.
Indonesia has become the first country in Asia to exceed 1 million COVID-19 infections. The milestone has been passed this evening after the reporting of more than 13,000 new cases. At the same time, hospitals are on the brink of collapse due to the overwhelming number of patients.
Indonesia hits a grim milestone as the country records 1 million COVID-19 cases. It comes less than a year since the first cases were confirmed in March. But experts say the true number of infections is believed to be much higher than the official tally due to the low testing and tracing rates. That works out to about 1 in every 270 people in Indonesia. Hospitals are feeling the brunt as ICU beds and isolation rooms are being rapidly filled up. Occupancy levels have exceeded an average of 70% capacity nationwide. Jakarta remains the hardest hit, reaching the 86% capacity. Both levels are above the recommended bed capacity set by the World Health Organization, capped at 60%. Even the medical staff are feeling the pressure.
Tiap hari kami merawat rata-rata di atas 95 pasien, sehingga kalau 95 per 156 itu udah hampir 80-an%, di atas 80% ya. Dan itu sudah warning udah tingkat yang bahaya. Malah kita pernah merawat pasien di atas 120.
But it's not just hospitals that are facing bed shortages. The world's most populous Muslim country is also running out of public burial grounds for COVID-19 patients. Several burial areas across the country are already fully occupied. Indonesia remains the worst-hit country in Southeast Asia, following the 1 million milestone, along with the over 28,460 deaths.
Sebenarnya mengkhawatirkan ya, karena kan 1 juta itu bukan jumlah yang sedikit gitu. Berarti dari situ diketahui tingkat kesadaran warga sendiri itu masih rendah gitu. Mungkin udah ada beberapa yang mengikuti protokol, tapi ada juga nih yang masih bandel.
Sangat mengkhawatirkan. Ya mungkin karena kurang kesadaran masyarakat kali ya. Sebenarnya bukan nggak sadar, mungkin entah nggak mau tahu atau nggak peduli. kayak pakai masker, harus cuci tangan itu harusnya wajib ya. Cuma di kota pun sekarang masih banyak yang nggak sadar harus kalau pakai masker itu wajib.
To fight the pandemic, Indonesia has rolled out a mass vaccination drive this month. Some 179,000 doses of China's Sinovac vaccine have already been administered. The government aims to inoculate about 70% of the population by March next year.
Saiful Bahri Ismail joins us live now from Jakarta. Saiful, a grim milestone for Indonesia. What went wrong?
Well, Dawn, it's a grim milestone indeed. It is significant as it gives Indonesia an opportunity to reflect again on how it has been dealing and managing with the health crisis. Now, Health Minister Budi Gunadi Sadikin spoke live on the government's YouTube channel this evening with regards to Indonesia crossing the 1 million COVID-19 cases. Mr. Budi said it is a moment to grieve for those who have died from the disease. And secondly, it's also time to be more aware and to work even harder to fight the virus so the sacrifices of those who have died, especially the health workers, do not go to waste. Mr. Budi said it's important to slow down the rate of infection, that is to flatten the curve. It has been nearly 1 year since Indonesia announced its first cases of COVID-19, and the country is still on the first wave of infections and has not been able to flatten the curve. Now, this needs to be done so that the healthcare system does not collapse, and it will give authorities more time to respond to the disease. Now, to do this, Mr. Budi urged all Indonesians to be more disciplined and adhere to the COVID-19 health protocols. And on the part of the government, Mr. Budi said, authorities will work even harder on testing, tracing, and isolation efforts. Now, earlier you asked what went wrong in Indonesia. One critical issue is how the country has been doing testing. The World Health Organization has recommended 1 test per 1,000 population per week. Now, that means Indonesia needs to do 267,000 tests per week. Indonesia has managed to increase its testing capacity to meet WHO standards, but last week, Mr. Budi admitted that the government had been conducting testing the wrong way. Now, he cited himself as an example. He said he had to be tested before every meeting with President Joko Widodo. Mr. Budi explained it shouldn't be like that. He said testing should be done for epidemiological purposes instead of private matters. Mr. Budi added that the ones who should take the test are suspected cases, not people who want to go on holiday or meetings.
And Saiful, how is the country going to deal with the shortage in hospital beds that it's facing?
Well, one way authorities are dealing with the shortage of hospital beds is to recommend those who are carrying the virus but without symptoms to self-isolate. Now, this is part of the effort to keep hospitals from running out of beds for COVID-19 patients needing further treatment. Now, the Indonesian Hospital Association said not everyone with COVID-19 needs to be treated at the hospital as long as they manage to self-isolate. The association also sees a possibility of sending recovering COVID-19 patients to a self-isolation facility to make room for other patients. Now, to avoid misunderstandings over the bed capacity limitations, the association has been working together with hospitals to educate the public about the situation. Apart from that, the Health Ministry has also committed to increasing hospital capacity by recruiting more nurses and volunteer doctors. Now, the Jakarta Health Agency has also planned to add more COVID-19 referral hospitals in the capital city. The selected hospitals would have to make several preparations beforehand, such as designing a zoning system to separate COVID-19 patients from other patients. The agency said there needs to be another facility for COVID-19 patients to separate them from the regular ones.